February is National Heart Health Month, and the American Heart Association is inviting you to go Red for Women. The Go Red for Women campaign was born in 2004 in an effort to dispel the myth that cardiovascular disease was, quote, an old man's disease. Cardiovascular disease claims the lives of nearly 500,000 American women each year. This year's campaign focus is Tell 5 and Save Lives. Here are some more eye-opening statistics from the American Heart Association's Heart Disease and Stroke Statistics Update for 2012. More than 2,200 Americans die of cardiovascular disease each day. That's an average of one death every 39 seconds. About 150,000 Americans killed by cardiovascular disease in 2008 were under the age of 65. Among all ages, coronary heart disease caused roughly 1 of every 6 deaths in the United States in 2008. We spoke with Dr. Gary Allen, Medical Director for Cardiothoracic Surgery at Florida Hospital Waterman, about the importance of recognizing the warning signs and how they present differently in men and women.
The origin of male versus female heart disease is for the same part coronary artery blockages. That's typically what we think of when we think of cardiac disease. And that disease process is really similar males versus females. On the other hand, there's behavioral and social issues. Men tend to be more sensitized to cardiac disease, so when they either experience chest pain or they communicate to their social network or their spouse that they're having chest pain, people tend to have heart disease higher on that alert list, as opposed to when females describe it, it tends to be described away as anxiety, indigestion, nerves. Women and cardiac disease has really been a very interesting history. Historically, we've always thought of cardiac disease as a primarily male-dominated disease, but as we come to understand the differences between male and female heart problems and also have a better popular understanding of what the data resources are, we've come to realize that actually cardiac disease is the #1 killer of women in the United States. And if you take the next 3 leading causes of death for women, things like cancer, including breast cancer, accidents, infections, and so forth, cardiac disease still accounts for more death than those next 3 combined. What's been challenging historically is popular education as well as professional education in understanding that females don't tend to present with cardiac disease the same way that males do. In other words, we're all familiar with what we hear of crushing chest pain or sharp chest pain in males as representing cardiac disease. Less than half of women represent those type of symptoms. So they tend to present later in their course and they tend to present with more complex disease. As a result, women with cardiac disease tend not to do as well with men with cardiac disease. So we have tried to educate our population, both medical and popular as well, to have a better understanding and to have a better risk management and screening technique.
You'll find more information about the Waterman Heart Center, as well as a link to the latest heart health statistics when you click the Heart Health for All story link on our homepage at yourhometownhealth.com.